This video will review how to add, edit, and deactivate hemodialysis accesses in Renal Insight. The topics that will be reviewed in this video include entering a new hemodialysis access, adding a backup or secondary access to the hemodialysis orders, editing and making changes to existing hemodialysis accesses, and deactivating a hemodialysis access. The following slides will go into more detail for each one of these individual topics and will be accompanied by a video.
When adding a new hemodialysis access, you will want to have the interventional radiology or operating room report on hand with the surgeon or radiologist's name, the date of the procedure, and the type and location of the access. To add a new hemodialysis access, I will first open the hemodialysis access summary. For the purposes of this video series, my patient has a CVC in place and has just undergone AV fistula creation. I will now need to add the AV fistula to their access summary. So to enter a new access, I will select the button New. You can see here their message has come up. This message is asking me if the new access will be the primary access. If I choose OK, this new access will become the primary access in our active hemo order. If I choose Cancel, I can still add the new access. However, it will not be set as the primary access. So if I wanted to add a new access that would be the primary access, such as in a CVC exchange, I would click OK. However, my patient's fistula is not ready to use and they will still have their CVC as their primary access for now. So I will choose Cancel. Because I chose Cancel, you can see at the top there are checked boxes here that note that this is an active access, but it is not the primary. First, I will select the type of access, and there are preset options for this located in the catalog. Today, I'm adding a new AV fistula. So I will click to highlight this option and we'll click the select button. So next I will record the access site by opening the drop-down menu. This patient's new access happens to be a left lower arm fistula. The needle type drop-down menu is used to indicate the size of the needle that will be used to cannulate the AV fistula or the specific catheter that was used. For instance, in a CVC insertion or exchange, I might use one of the catheters such as the GlidePath 19 centimeter. But where this is a new AV fistula, I will leave this empty for now and will add the needle type when the access matures and it is time to start cannulation. So now I need to complete the installation section here. The date installed is input using the calendar, and I will input it as the date of the procedure. Next, the surgeon would be added by choosing from the catalog. The local vascular surgeons and radiologists are included in the catalog. However, for today, I will choose Test Doctor. The circumstance for installation can be added by choosing from the drop-down menu. For this AV fistula, I will select permanent access as that is the plan with this access. In the comments section, you can type freely. You typically wouldn't use this for an AV fistula, so I won't add anything here for my patient. However, for a CVC, you would use this section to document the baseline measurement as well as the volume of the lumens. Now that I have filled in all the necessary data, I will click Save, and I will close this page. So you can see that my patient's new AV fistula has been added to their hemodialysis access summary. When a patient has two active accesses at once, the backup access will need to be manually entered into the hemodialysis order to ensure that both accesses appear on bedside to facilitate timely documentation. To do this, I need to add the AV fistula to the hemodialysis orders. I will start by opening the hemodialysis order. This screen will automatically have the current order highlighted. So to make a change to this hemodialysis order, I will click the Details button. Once the order opens, you can see that the tunneled line shows up here as the primary access. And I will leave this as is, and I will add the AV fistula to the backup access type by choosing from the catalog here. As you can see, this opens the hemodialysis access summary page, which will allow me to choose from their accesses. So in order for you to be able to add the backup access, you should note that you have to have already added the desired access into the hemodialysis access summary. So I will highlight the desired access and click Select to input this as the backup access type. You can see it now here. I will need to add a prescriber to save this change. For today, I will choose Test Doctor and select. In this example, we have the CVC as the primary access, and because our patient's fistula has not yet matured, we will have this in the backup access type so that they will both be assessed at bedside. And I can now save and close. So now both of these active accesses will appear on bedside. You can edit details of a hemodialysis access as needed. Edits you might make to the hemo access include the type of needle used for cannulation or changing the primary access. The example I've been using for this video series is a patient with a newly created AV fistula. Once the AV fistula has matured and an order is in place to begin cannulation, I will need to make changes to the hemodialysis access summary and the hemodialysis order. To make changes to the access, I will begin by opening the hemodialysis access summary page and then opening details for the desired access. I will need to select a needle type at this point. So I will select 17 gauge 1-inch needle, as these are the initial type of needle used with the cannulation protocol. As we progress through the cannulation protocol and the AV fistula becomes the primary access, it will need to be changed to the primary access. And I will do this by checking the primary box. I will now click Save, and this message will come up that says, setting this access to primary will modify the active hemo order with this access. Are you sure? And this is what I intend to do at this point, so I will click OK, and I can close this screen. So changing this access to primary will remove the CVC as the primary and replace it with the AV fistula. It will leave the backup access type empty once again, and therefore, while awaiting a CVC removal, I would have to ensure that CVC still appears on bedside, and I would need to manually enter the CVC into the backup access type in the hemodialysis order, as we did in the previous video. An access will be deactivated when it fails or is removed. An AV fistula may become clotted, or a CVC may be exchanged in the event of migration, dysfunction, or infection. In the example used for our video series, the patient's AV fistula has become the primary access and the CVC was removed. Therefore, I will be deactivating the CVC today. So I will do this in the hemodialysis access summary. And it is important to note that you cannot deactivate a primary access. Therefore, a new primary access must be added before completing this step. To deactivate the removed or failed access, I will begin by opening the hemodialysis access summary screen, and I will select the access that I wish to deactivate. In this case, it is a tunneled catheter. I will click Details on this access, and I will come here to complete the access failure section found at the bottom of this screen. I will use the calendar to indicate the date the access failed. This is the date the access stops working or is deemed inactive, which may or may not be the date it is removed. Because the line was removed on this date, I will check the box Removed. I will select the reason for failure from the drop-down menu, and an access could fail for many different reasons, as I previously mentioned. But for this example, I will select No Longer Needed. The Deactivated By will specify which prescriber gave the authorization to remove the CVC, or in some cases, who discontinued the use of an AV fistula. So I will select Test Doctor here today. Removed By indicates which physician removed the access. This is usually the interventional radiologist or nephrologist for a CVC. And then if an AV fistula fails, it won't necessarily be removed, so this may be left empty. For today, I will select Test External. Similarly, the date removed may be left empty if the access was not removed, but today I will enter today's date, as this is the date it was no longer active. And to complete that, I will click Save and Close. So you can now see in the hemodialysis access summary screen that the lack of check marks indicates that this CVC is no longer active. And that concludes my series.